Nursology Life, an 11-year LPN, here to offer aspiring and new LPNs advice and suggestions based on my experience of being an LPN. Today, I want to talk about 7 successful LPN habits to develop after LPN school. Now, this is not an exhaustive list, of course, but it's a good start. So, if this is your first time viewing this channel, welcome. If not, welcome back. And please hit that like and subscribe button as well as the notification bell so you don't miss any uploads, whether recorded or live, so that you can get the real deal, the sweet and sour, the good and the bad about being an LPN, which is a licensed practical nurse. If you have not started a nursing program centered around practical nursing, please view my video titled How to Become an LPN Step by Step Like a Boss in 2022, where I give tips on how to apply and get through a practical nursing program like a boss. So let's get right to it. Unlike RNs, LPNs normally do not get precepted on new jobs, so your training won't consist of actual nursing skills in the workplace. You will learn about the environment, policy and procedures, benefits, things of that matter, but not actual nursing skills, because the company for which you will be working for will expect that you have those skills already, or at least be willing to learn them on your own time. As far as long-term care facilities are concerned, you will not need as many skills, but you will possibly earn more income and work very hard. So it's up to you to decide which way you want to go right after school. Is earning a lot of income in long-term care or consistently gaining specialized skills more important? And again, that's totally up to you, because you know your situation better than anyone, which leads me to number 1. Develop the habit of gaining new skills over time. Believe it or not, your cell phone will be your teacher on the most basic level. Your cell phone will save you from a lot of time, heartache, and pain during your nursing career. I can remember being put on a unit inside of the rehabilitation facility one time with a patient who had a wound vac. And on this particular day, I had to change the dressing. I had no idea what a wound vac was or how to do it, and I couldn't ask the other nurse on the unit because she was too busy with her own patients. And on most days, we didn't have a wound nurse on duty. So I Googled the name of the wound vac machine and searched for a video on how to change the dressing out for that particular machine. The purpose of a wound vac is to pull fluid from the wound and remove bacteria. It also helps to pull the edges of the wound together, closing it over time with new wound tissue growth. So what I did was enter the patient's room after knocking on the door and being told it was okay to come in, introduced myself to the patient as her nurse, and told her that I needed to look at her dressing that came with her wound vac machine. So I proceeded to take a picture of the wound vac with its brand name and telephone number branded on the machine, and asked the patient if she had all of her supplies in her room so that I would know whether to look for them in storage before coming back to her room. I informed her that I would be back within an hour or so to change her dressing. I then left her room, found a quiet place to sit, and watched the video I found on how to change the dressing for that particular wound vac. And I found out that most of them will be pretty much the same. Most of the time when searching online, you will find a video, and other times you may not. But in those cases, remember, the phone number will be listed on the machine itself. You can call the durable medical company the equipment came from, and they will be able to walk you through it, hopefully on that same day. Durable medical equipment companies will also send a representative out to train the nursing staff how to use the equipment as well. There are also CEU courses that you can take online for a small fee to upgrade your skills and get certifications behind your license for various skills. Let's say you want to learn about medication errors, okay? You can get a CEU behind your license for that. You can take a CEU course online or locally in your city to learn hands-on. Number one Premier Continuing Education is an online resource that has state-mandated classes you can take to further your nursing skills. You get unlimited access to courses, and new courses are added throughout the year. CEUs are a great way to increase your skills, and they look great on your resume. It tells your future employer that you are equipped with the skills needed to get the job done. If you need more information, it's listed in the description area. And if you use the link I provided, you get 15% off. Also, if you qualify for federal student aid, you can apply for their $5,000 scholarship as well if you plan on going back to school. The bottom line is, the more skill you gain as an LPN, the more opportunities you will have to land well-paying jobs, and it allows you the ability to move around more in your LPN career. Believe it or not, some LPNs make as much as an RN coming out of school because of the skills they have gained throughout their work life. So keep that in mind as you navigate throughout your career. Number two, acquire good nursing supplies and maintain them. Most of the times, the facilities you will work at will have their own supplies, but they come few and far between, and everyone is using them, from the nursing staff, to certified nursing assistants, rehab therapists, and even physicians that come to visit their patients from time to time. So always have your own supplies. Just sterilize them in between patients. This will save you a tremendous amount of time, and please don't go cheap. Really invest in good equipment. I can remember a time I tried to listen to a patient's heart sounds, and my stethoscope literally fell apart in my hands. It was embarrassing and funny at the same time. But that's because it was a new hire gift from a facility I worked at previously, and it was cheap. The reason you don't want to go with a cheap stethoscope is because you want to actually be able to listen to heart and lung sounds. Typing in your nursing notes, lungs clear to auscultation, is very misleading when the clear to auscultation is really, I can't hear anything because my stethoscope is cheap. So please, please, please invest in good supplies. This includes good shoes that will take care of your feet, and clothing that won't fade or fall apart after a few washes, because you want to look professional, and you will be standing and walking on your feet for most of your workday. Wearing TED hose and good shoes will assist in good circulation and prevent premature issues with your legs, knees, and feet throughout your working career. I worked with a colleague one time while traveling who had worked so many hours over a 2-year period of travel nursing because she wanted to put 50% down on a future home purchase. She didn't know that she would also have to pay for foot surgery at the end of that 2-year stint because she failed to purchase good working shoes. So if you're looking for good quality nursing shoes, shoes like Nike Air Zoom Pulse is a really good brand for nursing professionals, even though it's not a nursing shoe, but make sure you get the right size. For nursing scrubs and accessories, check out Dress-A-Med in the description area. They offer free shipping with a $49 purchase, various styles and bestsellers, and they also offer a loyalty program where you will receive rewards for your purchases if you're looking for good nursing supplies such as stethoscopes, blood pressure cuffs, and things of that such. Medical Supply Depot is a one-stop shop listed in the description area as well. It's like the Amazon for medical supplies. Number 3, develop critical thinking skills and learn how to report to doctors for new orders. As an LPN, you will be implementing a lot of orders. When working at a facility, there are usually in-house doctors that you will be communicating with. Each doctor will have their own personality and pet peeves. Some doctors will be very nice, and most of them are. Others won't be as nice, and other doctors will be downright rude, cuss you out, and even hang up in your face if they perceive that you are coming at them incorrectly. This isn't right, but just because it isn't right doesn't mean it can't happen. I've seen it happen to nurses in the past when I was a certified nursing assistant. I've seen nurses even burst out into tears after a good tongue lashing from a doctor, okay? But in my experience, working with doctors, even the ones who are known to be a-holes, they will usually tone it down a few notches if you approach them professionally. And what I mean by professionally is to make them do less work by using your critical thinking skills and a few tools. That may be the issue behind the frustration of the doctors. When you don't provide enough information, you are wasting their time, they may think, and so don't make them dig for answers. Have everything already ready for the doctor when you pick that phone up. Have the most basic information ready, like the patient's name, room, phone number, date of birth, diagnosis, lab work, current medications, especially heart and seizure medications, allergies, vital signs, and health history at the least. Don't assume that when you call that doctor, they will automatically know everything about that patient or be sitting at a computer with the patient's information pulled up or ready to be pulled up. Most of the time they won't. Doctors are very busy, just like nurses, and they have lots of patients just like nurses. You want to paint a picture of what's going on with that patient, even if the doctor cannot pull up the patient's information at that time, because the doctor will make a decision sometimes based on what you are telling them at that time, and that decision will become an order, which now becomes a legal document in the patient's health file based off of what you did or did not tell the doctor. I would suggest having a template to go by, which includes SBAR. SBAR stands for Situation, Background, Assessment, and Recommendation. Let's go through them. Situation. What is going on with the patient at this time? For example, a 52-year-old patient has lower left extremity trace edema. Background, what is his health history? Essential hypertension and has never taken diuretics. Assessment, what are your findings? Is there pain and heat to the site upon touching? Is the swelling a new onset? Does the patient deny chest pain? Is respiratory even in unlabored? Are the vital signs normal according to what's normal for that patient? Has the patient urinated in the past 24 hours? What are the lab work results if they have already been ordered? These new findings can lead to new diagnosis going forward and new orders. Recommendations. What would you recommend to the doctor as the nurse? A urinalysis, CBC panel, Doppler study, 24-hour urinary collection, metabolic panel, or even a small dosage of a diuretic. The SBAR tool can help you collaborate with the doctor. If you don't have one at your disposal, there is one in the description area that you can download to your computer for free. Just print it out, and all you will need to do is fill it out at the time that you need it so that you can use it to relay the information to the doctor. Also, you may want to lock that physician's phone number in your cell phone, because there will be a lot of times when they will call you back with orders and you don't want to miss that call. You also don't want to rely on facility staff to pass that information to you, especially if there is no unit secretary, because you may never get that order. Trust me, after you've done everything that I've mentioned and you still get a rude doctor, because some doctors will just be rude for the sake of it. This is your chance to develop thick skin by saying to yourself, this is about the patient, not about my feelings or the doctor's attitude. And stay professional. Even if you feel the need to ask the doctor to treat you with some respect, but do it in a way that is respectful and professional. If they start to call you names, you have the right to hang up and walk away. Don't accept abuse at any cost, but don't stoop to their level, or don't have a shouting match with them. Just stay focused on the patient, and by all means, stay professional. Is it hard to do? Yes, it is. But it gets easier over time. And most times, as the doctor gets used to speaking with you and getting to know who you are, trust me, they will lighten up, especially if they know, hey, this nurse is not a pushover and she has it all together. Remember that. Number 4, develop a good working relationship with your CNAs. Early on in my nursing career, I had a shouting match with a CNA, and I felt so ashamed afterwards because that was my opportunity to show professionalism in a way to where it would have gained me more respect from the other CNA onlookers and other staff alike. That was a teaching moment for me, and I made sure that that scenario never played out in my nursing career ever again. Listen, good nurse to CNA communication is so important. So I started implementing some strategies to become more approachable. What I would do once I became new to a unit is I would call all of the CNAs I was assigned to work with on that day to a meet and greet, and I would do this at the time when schedules are being made at the beginning of the shift, so that it wasn't so formal and I wasn't taking them away from their work, because CNAs work very hard. Nurses could not function without them. So at that time, I would introduce myself and let them know, hey, that if they found anything different going on with a patient, to let me know, even if it seemed insignificant. This will give the impression that you are very approachable and that you care about your patient in turn. And you do care about your patient, or else you wouldn't be a nurse, right? So the CNA will feel more easy about asking questions and for suggestions. And this in turn will increase the quality of care for that patient. Will communication with CNAs always be this easy? No, because just like every physician has their own communication style and personality, so will every CNA. Also, just like nurses, you will have the ones who go above and beyond in the care of their patients. You will have those who will just do enough to skate by. Then you will have those who won't do anything but ride the clock. And you will know who they are, because you can best believe that the oncoming shift will let you know if something was not done. And if the CNA has already left the shift for the day, that adds extra work to you and the other staff. Okay, because the next shift is going to want to make sure it gets done before they start work. So just make sure you work along with the co-workers in your unit in a synchronistic and systematic fashion to cut down on complaints. And don't be afraid to go to the director of nursing if you feel resistance, because they may be able to resolve issues you can't. But again, stay professional. If the conversation gets too hot, walk away and go get help. Number 5, take care of your own health. Remember, I was telling you about the nurse who messed up her feet while walking on bad shoes for 2 years. That falls into the category. A good pair of shoes will carry you a long way. Also, make sure you drink enough fluids and eat enough food throughout the workday. Many nurses fall into the habit of not drinking fluids because they don't want to stop and take a pee break. But this lends to dehydration, which over a long period of time will contribute to kidney stones, urinary tract infections, and even kidney failure. So try to stay as healthy as possible throughout your nursing career, because sick patients pull on your energy. And if your energy is low and you're not taking in enough fuel, this will cause you to not perform at your optimal level, which could cause fatal mistakes. that could cost you your license and even jail time. Some things you can do is to bring small healthy snacks and drinks with you in a snack bag that zips up completely, preferably with hot and cold compartments. I used to bring a big bag, big enough for everything to fit in and small enough to fit at the bottom of my med cart. Most of the times, I did not keep my food in the break room refrigerator because it's a shared refrigerator. And I can't count how many times over the years someone on duty has had their food stolen out of a shared refrigerator. So be mindful of that. Okay. Number 6, know where your crash cart is. Nurses, this should be one of the first things you look for when you start your shift. A crash cart is a huge container, usually red in color, with drawers and wheels at the bottom that contain emergency equipment and medication for emergency situations. Every facility will have one. There will also be a tag attached to it with a list of what should be on that cart. Make sure you check at the beginning of your shift that everything is in there and functioning properly in terms of equipment, and make sure all emergency medications are before the expiration date. You don't want to run into a situation where a code is being called and you go to grab your crash cart only to find that the bag valve mask is not functioning correctly, or that there is no nitroglycerin spray in the drawer, or that if it is in the drawer, it's expired. So the overnight shift is usually the shift that checks the crash cart and signs out on it. But don't be surprised if the facility doesn't have a system for checking it. At the end of the day, if something happens to one of your patients on your shift and the crash cart falls short, the accountability will be on you if something happens that could have been prevented. You will not be able to blame it on the previous shift. So always check your crash cart at the beginning of your shift. I cannot stress that enough. Number 7, always practice the 5 rights of medication. There is a nurse who is currently facing jail time due to not practicing the 5 rights of medication, which caused the patient's death at Vanderbilt University. And if you haven't heard that story, again, what do I always say? Just Google it. So what are the 5 rights of medication? The right patient, the right drug, the right dose, the right route, and the right time. And if the 5 rights of medications are hard for you to remember, just get a 3x5 card and write them down and check them off as you go. Medication errors can happen to the best of us. You can be the best nurse to have ever walked the face of this earth, and you will make a medication error. From a very small one, like giving the wrong over-the-counter supplement, to giving a fatal medication that looks and sounded like the medication that was supposed to have been given, ultimately causing a patient's death like the one at Vanderbilt. So when it comes to the right drug, what is the diagnosis for taking this drug? A diagnosis should always be listed in the order. I cannot tell you how many times I've ran across medication orders with no diagnosis or no symptoms attached. This is important because there are many medications on the market that can be used for several conditions. Does the diagnosis match the drug? If you're not sure, get an order clarification from the physician or call the pharmacist filling this drug. You can also get medication apps downloaded to your phone. But if you are in doubt, just taking these few extra steps will save you from making any unnecessary mistakes. Developing all of these habits I mentioned early on will become like second nature over time. You will do them almost without thinking about them. Of course, these habits are not an exhaustive list, but I feel that they are the most important to make your workday flow as smoothly and as effortlessly as possible. For tips about developing habits that will carry you far in your career, check out my most popular video, Tips for New Travel Nurses, LPN edition. These same tips can be used for non-travel nurses and everyday workflow. This is Nursology Life, your go-to person for knowledge, tips, and thought-provoking content centered around that LPN life. Thank you for listening, and until next time.